Good morning, everyone, and thank you very much to the media members from TV and radio and print. Thank you so much for continuing to get this pertinent information out to my lovely sign language individuals. Thank you very much for being here. To Dr. Roos, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, thank you for being here. Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, sends his regrets, unable to be here today, but I do have a statement that I will read from him. And I want to thank AMR. They've been absolutely outstanding. Partnership, Patrick Leonardo, who's always here, the Director of Operations. We appreciate that. And of course, to all my cabinet heads, down the rank and file, and their families, thank you for all your continued and dedicated efforts. Again, they are tested and true through a number of natural and man-made disasters as we move to defeat this COVID-19 coronavirus pandemic, which we will. I'd also like to wish soon-to-be President Joe Biden and Vice President soon-to-be Kamala Harris and their families good health and success. For if they succeed, each and every one of us will succeed here in the United States of America. So congratulations again, President-elect Biden, Vice President-elect Harris, as you get inaugurated tomorrow. And we will work hand in hand with you to continue to help us move the city of Springfield forward, Commonwealth, Massachusetts forward, and the United States of America forward. So, good luck. Let me give you an update. Total confirmed COVID-19 cases have now risen to, since the start of this ordeal, 13,716. The weekly total was 1,037. The monthly total is running at 2,394. Unfortunately, Commissioner Helen Calton Harris reports to me earlier this morning that we have 11 more deaths, Springfield residents who have lost their lives due to this terrible COVID-19. And as always, our thoughts and prayers go out to each and every one of the families and friends who have been affected by this. May God rest their souls. That brings the total number of Springfield residents' deaths to 179. Of that, 73 are white, which breaks down to 40.7%. 40 are black, which breaks down to 22.3%. 61 are Hispanic, which breaks down to 34%. Asian is 5, which breaks down to 2.8%. The trend has been, for these individuals who have lost their lives, has been a residential trend that continues. The long care term facilities has stayed stagnant. Residential, 121 of those are residential that have passed for 67.5%. Long-term has stayed steady at 58, which is 32.3%, 0.5%. Excuse me, my writing. Governor Baker's, the AMR Stop the Spread with Patrick Leonardo at AMR, the testing continues. Vaccines, I want to thank Commissioner Helen Carlton Harris. 920 vaccine shots have been given to the first responders in phase 1. That will continue moving into this week. Helen and I will continue to advocate for expansion of not only testing but vaccines. Flu shots, we do highly recommend that you get it. Superintendent Warwick will clarify that a new directive has come out from the state on flu shots pertaining to students, that it is not mandatory now, but highly advised, but he'll speak on that. Senior citizen meal deliveries continue. We added a few more last week, deliveries to their homes, and they deeply appreciate that. So to Helen and Sandy Federico and to Vanpool, we appreciate that. Speaking of vaccine sites, my administration was contacted Sunday evening, and I look forward to Governor Baker, Lieutenant Governor Polito making an announcement in the very near future that the Springfield area will have a max vaccination site very shortly. But I'll allow the governor and lieutenant governor to make that announcement. We appreciate as we advocated for that. So Springfield will have a mass vaccination site announced very shortly, and we appreciate that from Governor Baker and Lieutenant Governor Polito. I'll let them detail it more. The Vax Force, we held our first meeting, Commissioner Helen Carlton Harris and the very diverse and professional group, and that's going to play an important factor of getting out the word and dispelling misinformation. So we're going to continue to move with that. Had a good meeting with our new council president, Marcus Williams, in his spirit of working together, cooperation. Department of Justice, we continue our Zoom meetings and with Judge Ireland, Commissioner Clapwood, and Solicitor Pakula, and the rest of the team. A good couple-hour meeting last week as we look forward to not only more initiatives on Commissioner Clapwood's side, but also getting this situation, a mutual agreement, resolved moving forward. Echo Dev, Director Sheehan will speak to you on a number of fronts, but we continue to put together our post-COVID-19 vision. And we had a good meeting with Tim Bramble out of Chicago and our vision pertaining to the South End riverfront downtown area with museums and housing and MGM and other things. So this has not stopped us in moving forward and continue initiatives, economic development, housing initiatives, not only in our downtown area, but in our neighborhood areas. So stay tuned for future announcements to come forth. School committee meeting, very good meeting Thursday evening. Superintendent Warwick will update you on that. Retrofits continue. We put across a draft reopening plan, hybrid plan. And again, I want to thank Director Patrick Sullivan and Commissioner Helen Carlton Harris for being on that meeting too, to reassure our school committee members. Yesterday we celebrated the iconic Reverend Dr. Martin Luther King Jr. Day. We had a nice ceremony here, smaller because of COVID-19, Friday. And I want to thank my aide, Coach LeVar Glick, for putting that together. And we did that in partnership, as we usually do, with the NAACP and Bishop Talbert Swan, which he was also sworn in as president again, and we did the flag raising and had a great student speaker from my alma mater, the High School of Commerce. And Commissioner Clapwood was also there. Yesterday, it had to be virtual, but then again, another great MLK presentation. We normally do at the Mass Mutual Center with a couple thousand people. But I want to thank Springfield College, Martin Luther King Community Center Family Services, Ron Johnson, Springfield College, President Mary Beth Cooper, Eileen Cafferty, Community Music School, Benjamin Smith, the Dream Studio does a great job. And I was honored again to bring some remarks, as did Governor Baker, who personally comes down to these events, but we had to give our remarks virtually on that. Commissioner Clapper and I continue to work with state and federal officials in coordination for any possible negative activities that might occur pertaining to the inauguration of President-elect Joe Biden and Vice President-elect Kamala Harris. So we will continue to stay on top of that. If anything is to occur, we'll be prepared. I had a great visit from one of my former interns, or early interns, Bria Brantley, and I say it, this is a great story. It's going back maybe some 10, 11, 12 years ago. She's now got a beautiful baby boy, Colby. She's pursuing her PhD at AIC, and through the First Time Home Buyers Program, bought her first home right here in the city of Springfield. So that's a great story. We continue with the Oasis Food Bank and John Foley. So that's going the Food Bank of Western Massachusetts, Andrew Morehouse at Central High School, and partnering with my city departments, DPW, the school department, police department, and fire. We're servicing about 3,500 families on Fridays. Commissioner Clapper on the police side, she will update you, but in total, they are down 28 with COVID, 25 that have it, 3 pending. Included in that is a number of 8 out of the academy, so they're Zooming it right now. They continue with the vaccine and testing. As I stated, we'll continue to coordinate with our state and federal partners for any type of potential protest pertaining to inauguration. And as always, we'll make sure that all our residents, no matter what creed, color, or background, and business community, will be protected. Commissioner Calvi indicates he's down 11 COVID, 25 pending, total 36. He's taken a pretty good hit there. Vaccine and testing continues. They had a couple fires. He'll speak of Saffron Circle and Davenport Street. Superintendent Warwick, we're over the 5.5 million mark in meals served, 5,565,314. Over the long weekend, 102,640 meals were given out to our students and families. This is at 17, 18 various sites across the city. Breakfast, lunch, dinner, and snacks. Superintendent will elaborate again. The retrofit continues. We presented a draft hybrid reopening plan. He'll speak to you and clarify on the flu shots. Attendance rate has ticked up to 92.2%. And again, I want to thank Commissioner Helen Carlton-Harris on the testing. Winter sports has started, and we had a very, very low positivity rate on the testing, which is good. We're going to test 3 times for our student athletes for winter sports. DPW Director Chris Signoli indicates he's down 5 with COVID, 1 and 4 that are testing. Christmas trees are still being picked up and core services continue. Christmas trees on your recycling day, and that goes to the end of the month. On finances, my CAFO TJ Plan indicates revenue loss since this has started is $7.3 million. FY21, we're down $2.4 million. Total spent on grants and deficit is $20.3 million. Of that, 7.5 again is deficit spending. So we've spent $27.8 million in total to make sure that we're able to provide for our residents and our business community. And again, we continue to track all costs to go after every dime of reimbursement that we can get, whether through the CARES Act or FEMA, as we've done with other natural and man-made disasters. Facilities and parks, Patrick Sullivan indicates to me he's down 5 with COVID. He and his team have done yeoman work on retrofitting our schools and our municipal buildings, and he'll give you an update on that. Pat on his park side is going to speak to you about ice safety. Yes, believe it or not, because we're going to get cold in the evenings, about people staying off any water type ice activities, but he'll speak to you on that. Echo Dev, Chief Development Officer Tim Sheehan, he is down 4 with COVID-19. Director Sheehan will speak to you specifically more about the SBA, Small Business Administration, and the PPPs coming out, and he'll also give you an update on Wayfinders, on the money we put out for residential, for help on rents, utilities, and mortgages. And he might also speak to you about on some post-COVID-19 economic development visions that we're going to be announcing in the near future. Again, Solicitor Pakula on DOJ and Attorney Bill Mahoney in Law and HR, the status co-updates came on that. With that, let me just read a statement, and again, from Dr. Kerouac. He sends his regrets, but let me read his statement, and then I will bring up Dr. Bruce. And after Dr. Bruce is done, as we've done before, he will take questions from the media so he can get back to his important duties at Mercy Hospital. So again, this is a statement from Dr. Mark Kerouac, the President and CEO of Bay State Health Systems. Dear Mr. Mayor, I regret that I am unable to appear at this week's press conference. I am chairing a meeting of all the leadership at Bay State Health, and that also means that I cannot send a substitute, which he usually does. Yesterday, Bay State Health and the city celebrated Martin Luther King Jr.'s birthday. It was particularly poignant this year, in which all people of goodwill are yearning for a greater sense of community and justice. I am furnishing this report to share the current news of Bay State, as well as my impressions of the state and national trends. I continue to be grateful for your leadership during the crisis and for the collaboration between our teams. Thank you. The COVID-19 pandemic achieved a number of tragic milestones this past week. Global deaths surpassed 2 million, and deaths in the United States surpassed 400,000. With over 4,000 Americans dying of infection each day, COVID-19 is now our country's leading cause of death. The state of Massachusetts has recorded over 444,000 cases and 13,300 deaths due to the virus. With over 5,000 cases and over 70 deaths per day this past week. About 2,200 individuals are hospitalized in the state, which he indicates is a stable number. And the positive test rate has declined a bit to about 6%. Since the latter tends to be the predictor of future needs, this is a good sign. At Bay State Health, we have seen a slight uptick in cases. Currently, there are 150 patients hospitalized across the system, 117 that are at Bay State Medical Center right here in Springfield. 33 are in our community hospitals and 13 in critical care. We continue to have adequate surge capacity and adequate supplies of personal protective equipment, PPEs. Testing capacity remains the same as last week. Our Bay State Health rollout of the COVID-19 vaccine continues according to state guidelines, which are published on mass.gov. In accordance with the first phase of Massachusetts vaccine rollout plan, and in keeping with its priority order, we have vaccinated over 8,000 Bay State Health employees and have begun second doses of over 2,000. We are now vaccinating over 1,100 providers and staff from private physician offices in accordance with the state's plan. On a statewide and local level, we are pleased to see that first responders' vaccines have started. Vaccinations of individuals in congregate care settings, prisons, and shelters are planned to start soon, which my understanding is this week. This will be followed by vaccination of home care workers in a program which we hope Bay State will have the opportunity to coordinate with the state. We recognize that so many people in our community have questions about timing for individuals' vaccines. Our provider offices do not have this information, and we encourage people to hold back on calling doctors' offices or our main number, and rather watch for details on mass.gov website, which the state updates in regular fashion. In addition, the governor's media briefings are a good source of information. As we have done on a regular basis since the start of the pandemic, Bay State Health will proactively reach out to our community with information that we know our community wants and needs. And we ask for patience as the statewide plans move to the next step. We are all eager to get started vaccinating high-risk patients as Phase 2 begins in early February. The state has received over 660,000 doses of vaccine and has administered about 300,000 doses. Some of the remaining vaccine is being held for second doses or for scheduled first administrations among the groups I mentioned above. Completing the vaccination of another 4 million adults in the state over the next few months will require a dramatic acceleration of rates of administration that will depend on, one, a more robust and reliable supply of vaccine from the federal government, something, again, that has been promised by the incoming Biden-Harris administration. Two, the opening of multiple mass vaccination sites like Gillette Stadium across the state. And again, I mentioned to you today that we will have something of that in the Springfield area, but I will allow Governor Baker, Lieutenant Governor Polito to make that announcement shortly. Three, close collaboration between health systems like Bay State, the Department of Public Health, local boards of health, which we already have established and continue to work very well with. Four, the approval of the products of 2 to 3 additional vaccine makers that are in the final stages of clinical trials. We look forward to these steps unfolding in the next several weeks to months in what will be one of the largest public health undertakings in our nation's history. Finally, in the meantime, please remember that your best defense is the consistent observance of public health measures, which we have emphasized these past months. They include masking, maintaining physical distance, avoiding crowded places, particularly indoor venues whenever possible. These measures work, but sadly, the reason we are seeing more cases and deaths is because they are not being consistently followed. The emergence of a new and more contagious strain of the virus, which was detected in Massachusetts this week, does not mean we should change our plans for protecting ourselves with public health measures or vaccines. This mutant strain is still in the minority in most places across the country, although it is forecast to become the dominant strain by March. It does not cause more severe disease, and it can be stopped by vaccine and by the same public health measures of masking, physical distancing, avoiding crowds that we know have worked against the original strains. The arrival of this new variant simply means we need to be more consistent in observing public health measures and accelerate the rate of vaccine administration. Mr. Mayor, I thank you for the opportunity to share my thoughts. I appreciate the media's consistent, fact-based reporting, and I look forward to seeing you all next week. Sincerely yours, Dr. Mark Kerouac, President and CEO of Bay State Health Systems. Thank you for indulging this written statement. It's important. We appreciate Dr. Kerouac's continued efforts, and we'll see you next week. As we appreciate Dr. Robert Roos's continued efforts at Mercy Trinity Healthcare, the Chief Medical Officer. So without further ado, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, Dr. Robert Roos.
Well, thank you, Mayor. And thanks to your entire team as well as for the constant collaboration amidst the pandemic. And good morning, everyone. As we stand here week after week and provide updates about the pandemic, I had the opportunity today call us to reflect on a quote from the Reverend Dr. Martin Luther King Jr. that the ultimate measure of people, and perhaps in this case a society, is not where we stand in moments of comfort and convenience, but where we stand at times of challenge and controversy. And there is no mistaking the fact that this entire year has brought challenge and adversity in health, in economics, in society. 2 days from now, January 21st, marks one entire year since the first case of the coronavirus was diagnosed in the United States. And there are still many challenges ahead of us, with surging cases in hospitals across the country, with a new, more infectious variant, and the need to escalate and improve a global vaccination campaign. But as we talk today, and you listen, I think it's important to know that there is an opportunity for all of us to do things different. That we have an opportunity to determine how we are collectively measured when history looks back at this moment. It's one of great consequence. There have now been more than 95 million infections across the globe and more than 2 million deaths. There have been more than 24 million confirmed infections in the United States and over 400,000 deaths here. In Massachusetts, there have been nearly 450,000 infections and over 13,000 deaths. As was mentioned in the statement by Dr. Kerouac, COVID is the leading cause of death in the United States. We are not through this. The cautiously positive news from the last week is that it does appear that we have started to see a flattening of this latest peak in both new cases, test positivity, hospitalizations, and deaths here in the Commonwealth of Massachusetts. It's really only been seen in the last few days, but the 7-day average has started to crest and even dropped slightly, so that the number of new cases is closer to 4,000 than it was at 5,000. The test positivity rate has decreased to under 6% all in, and the hospitalizations have gone down to 2,200 from 2,300 plus. There are still hospitals, however, that are experiencing challenges with capacity, as we heard recently that Mass General Brigham has opened up a surge ICU. At this point here in Western Massachusetts, however, we are continuing to fare a little bit better. In our region, Region 1, I represent Mercy Medical Center every single day on calls with all of the other hospitals across the region, Bay State, Holyoke, Cooley, Berkshire, where we review the capacity in each of our hospitals for staffed beds, both medical, surgical, and intensive care. And thankfully, we have not needed to transfer any patients to alternate facilities or to other hospitals within or outside of the region. So while our hospitalized cases remain high, We are managing very well. We're delivering all types of care, and we're doing it safely. This morning at Mercy Medical Center, our numbers have gone up from last week. We have 37 hospitalized patients, 2 of which are in the intensive care unit. Yet despite the higher numbers, we do continue to discharge patients with COVID each day. We continue to treat patients for all types of care, including cancer, heart disease, stroke, infections, orthopedic injuries, and so forth. And so I want to highlight the importance, again today like we did much earlier in the year, for you to continue seeking out the significant medical care that you may need. It's a concern of mine that recently I read a study published by the Kaiser Family Foundation that suggested that 25% of Americans in December had reported that they or someone in their household had delayed or skipped or postponed serious medical care in the past month due to their concerns about the coronavirus. We also continue to see that here in our community. I was speaking with one of our neurosurgeons last week, and she was detailing to me someone she had evaluated in our emergency department who was having significant neurologic symptoms that could present a risk for loss of mobility in her legs going forward. She unfortunately had delayed coming to the emergency department, not for hours, but actually for a few days. When she was asked why, she noted that she was concerned about COVID for herself, contracting it, as well as the hospitals being full with patients with COVID. When she received the care, she was reassured that that was not going to be a risk. But these types of scenarios can sometimes be discovered too late. We saw this in the first surge, with people delaying coming to emergency departments for care, including things like abdominal pain that could be in need of a quick operation, or people presenting for what could be a heart attack. We do not want to continue to see people's health suffer as a result of this. We want you to know that it is important that you do not delay your care, whether it's preventive care, primary care, specialty care, or most critically, emergency care. We are here for you. We continue to provide all types of care. We have the resources to do so, and we have the protocols to keep all that care safe for you. I do want to talk, though, for a moment about what the next few months look like. Because as I said last week, we are in some respects in a race against time to vaccinate large numbers of people to create herd immunity. And as has been mentioned, there is an infectious variant that's been identified in the United Kingdom and is the predominant strain in the United Kingdom now, called B.1.1.7, that has been identified here in the United States and in many other countries. The Centers for Disease Control did release a report over the weekend, and I want to highlight a few important things about this variant. First, it's important to recognize that viruses of all sorts can and do mutate. It's not expected at this point, a year in, that there is and there are multiple different strains. The longer that the virus is given the opportunity to replicate, the more likely that additional strains will develop. The best way that we can combat this is to tamp down and eliminate viral transmission to the highest degree possible with all of the public health guidelines that we have been touting since the beginning. This B.1.1.7 variant is modeled to be the most prevalent strain here in the United States by as early as March, even with a large-scale vaccination effort. The variant could lead to an increase in the rate of infections that could continue well into the summer, surpassing the rates we even see now if we do not combat this with the same vigilance, or actually a stronger vigilance than we have to date, and also a successful vaccine campaign. The good news is that it does appear that the vaccines that are currently available are effective and do confer protection against this variant. And the CDC and others continue to monitor variants that are seen in other countries like Brazil and South Africa to determine if that would be the same for them. This is of concern. There is a high degree of community transmission that continues. An example of that is even in the last 24 hours, we've had 6 different patients who were scheduled for procedures who are just being tested for asymptomatic screening prior to an operation that have come up as COVID positive. So it only becomes more important than it ever has before that we escalate this vaccine campaign as quickly as we can, all throughout Massachusetts and beyond. When we look at the numbers, a total of 539,550 doses of vaccine have been shipped to Massachusetts, and about 317,000 doses have been administered. This was released yesterday. The focus on releasing the vaccine continues here in Massachusetts to ensure that we have the appropriate amount of second doses to line up with each first dose, and that we walk through the priority order sequentially to ensure that those groups are vaccinated in order. At Mercy, we have administered over 3,000 vaccines to date, with over 860 colleagues that have now received their full vaccination series. Today, now that we've vaccinated many of our eligible colleagues, or all of our eligible colleagues that are interested, we are going to be opening up our vaccine clinic to other eligible members of the community going forward for appointments on January 25th. It's very important to understand that eligibility is determined by the Department of Public Health. Right now, that includes COVID-facing healthcare workers, first responders, and residents and staff of congregate care facilities, shelters, and prisons. Next, it will include all home-based healthcare workers and non-COVID-facing healthcare workers in the coming weeks. It's not until phase 2, which we expect to be sometime in February, when eligibility will open up to the general community per the age and the health condition guidelines, and then additional essential workers. If you are a first responder or an eligible healthcare worker or resident of a congregate care facility and you are interested in receiving your vaccine at Mercy Medical Center, you can go online to www.trinityhealthofne.org/mercy-vaccine. You can complete a request for an appointment, but please know that all vaccines are delivered by appointment only at this time. In order to continue to provide the highest level of care and ensure our vaccine supply, we are not able to accept walk-ins. The appointment request should be made within at least 48 hours in advance, and it will require you bring proof of eligibility that you would fall into one of the groups when you arrive for your appointment. If you're interested in finding out when you are eligible or when you can get a vaccine, please go to the Massachusetts Department of Public Health website at www.mass.gov/vaccine. Do not call our provider offices or our hospital's main line. They don't have that information. Please try to continue to be patient. We know that this is an exciting time. We are just as eager as you to move as quickly as we can through this campaign. But just as it has been said, that in times of conflict and controversy, that peace is not the destination, but it is the way. Remind yourselves, as we must all do, that vaccines are not the destination. They are merely the way. And the path will get wider and smoother as this goes along. So please, for now, stay safe, remain vigilant with masking, physical distancing, limit your travel and gatherings, and be ready to sign up for your vaccine when you are eligible. Thank you.
Thank you. I know that Nick Oresco's here, Mike 22, and Sarah Brunelli, and Eric 40, Paul, and Matt. Any questions or comments for Dr. Roos.
Dr. Roos, where vaccination has begun, we're still seeing a lot of disease rampant in a lot of places. But at the same time, I can't help but look at the Northeast as being not great, but nowhere near as bad as it was in the spring by any definition. And yet we're also supposed to be bad off as Europe, which I think most people would agree with the United States is screwed up a lot more than Europe has. Do you have any explanation as to how we're maybe already along, not perfectly, but better than other parts of the world that, 6 months ago you'd be shocked to say are worse off than we are right now?
So that's an interesting comparison, because I think in many regards we would still be considered to be one of the leaders with some of the poorest outcomes and case rates when comparing countries. So certainly when we look at what's been done over the past year, there have been many missteps, as I would see it, and a real lack of providing a true coordinated effort to address the pandemic that has led the United States, of course, to have the highest representation and proportion of confirmed cases, one of the highest death rates when compared to other countries of similar economic size and social demographics. So I think in many ways there is great opportunities for improvement in what the response has been thus far when you're looking at and comparing countries. In looking at regions, it can be a little bit harder to assess, as so much of this has been done by the states. So much of it had been determined, particularly early on, where urban centers suffer the most disproportionate impacts. And then we saw the sort of second wave where that went across the country. So, here in Massachusetts, we are actually experiencing levels of hospitalization that are very similar to what we saw in the first surge, and actually lasting longer than what we saw in the first surge, which was a much more significant slope, both up and down. One of the reasons why that has been, I think, mitigated to a stronger extent is because the approach in Massachusetts has been steady. It has been fact-based. It has been consistent. It has continued to adapt but not be reactionary. And I think when taking those principles, the individual strategies, may differ a little bit by state to state, but are help what lead to prevent sort of the massive devastation that's been occurred in some other places. But we have a lot still to learn and a lot still to get through, particularly as we face new variants that could become the predominant strain here in the U.S.
And last week, you had Dr. Carr talk about your vaccine allocation being completed and have gotten.
Yes.
Has that changed at all? Is there now more stock available to receive and that?
Yep.
Is that changed in the last week?
It has. So I would say in the last week, we have received regular communication. We have received the vaccine allotment that we have requested on a weekly basis, and it does appear that that process is moving smoother. And so we are able to move through our campaigns, schedule appointments, and vaccinate people in a cadence that's much more predictable, which is helpful for not only the operation but also for the community that we are serving with this. So I would say that that's improved dramatically in the last week.
And I'm sorry, I apologize if this is for, what is your rough estimate of when your own staff and everybody will have their second shot?
So we've given about 2,300 first doses overall. We've given 860 second doses. Most of that is for Mercy Medical Center or Trinity Health colleagues specifically, although we have branched out and now given doses to first responders and other eligible COVID-facing healthcare workers outside of our hospital. But specifically at Mercy, when we think about a staff of about 1,200 having 860 already vaccinated, we are well on our way to having our closest staff fully having completed that series. And so the next 2 weeks would really be the time when we would be concluding most of those vaccine series.
Paul or Paul?
With all of the attention rightfully focused on the vaccine, you mentioned that you are envisioning discharging more people after the treatment. Can you talk about the improvements that we're seeing in Springfield?
Sure. Yeah, so in thinking about the treatments and the interventions that we have addressing serious cases of COVID that require hospitalization in some cases and in some cases not, we are, right now, we have a much better understanding of many things about the coronavirus, not only how it's transmitted, but how it can impact organ systems and create complications. We know that there are many interventions that can be done without medications that now help improve outcomes and have led to higher rates of discharge and lower rates of mechanical ventilation, ICU admission, and death. Those include the earlier introduction of oxygen, what we call high flow oxygen, the later introduction, only when necessary, of intubation and mechanical ventilation. It also includes the proning of patients, which is to move patients onto their stomach if they are able, to allow them to more fully oxygenate sort of the posterior or back part of the lungs. It also has included then the introduction of medications that received authorization for the treatment of moderate to severe cases of COVID, which have included a cocktail, if you will, of remdesivir and steroids like dexamethasone, which have been the single medications really that have shown a mortality benefit in treating patients with this disease. If there are patients that have a milder form of the illness and may not need hospitalization but would be at risk of hospitalization, as many folks know, there were some monoclonal antibody products that were given authorization that could be delivered via infusion. I think the array of options, I think the level of skill and expertise amongst the providers has all increased. And all of those contributions can lead to improved outcomes, those in which we're seeing now and those that we would continue to expect to see as long as there's no significant changes in the virus pathology itself.
Sarah or Nick? All set? Okay, Dr. Lewis, thank you so much.
Thank you, Mayor.
For helping you and your family and your staff. Appreciate your partnership. And again, Commissioner Helen Carlton Harris and I and our team will continue to advocate aggressively, diplomatically aggressively, to continue to expand testing and to get vaccines and sites here ASAP, and not only for to protect and preserve our city workforce, but to our population, especially our seniors, as soon as we get the guidance from DPH. So I want to thank Commissioner Helen Carlton Harris and her team. It's been a juggling act. At times it gets very emotional at times, but we're going to continue to put forth. So without further ado, our Dr. Anthony Fauci, Commissioner Helen Carlton Harris, and we look forward to a significant and specific plan from the new administration coming in on the federal government, which I think is going to be key to helping us here in the city of Springfield. Commissioner Helen Carlton Harris.
Thank you, Mayor Sarno. The city of Springfield's COVID-19 pandemic numbers continue to be extremely high. I'm going to begin with the line graph, COVID confirmed cases by month. As you can see that so far this month, there's 2,394 cases already. What that means is that we are about halfway to the point that we were in December, and so we're looking at potentially another month of record COVID cases in the city and in the Commonwealth of Massachusetts. You can see that in August we had 182 cases for the entire month, which was our low cases, and we are seeing that and more on a daily basis. On Sunday of last week, there was 167 cases. This is the COVID confirmed cases from January 10th to January 16th, 167 on Sunday. The 30 reported on Monday was a glitch in our Maven system from the state, and so The next day, Tuesday, there were 214. That included additional cases from Monday. Wednesday, 181 cases. Thursday, 116 cases. Friday, 213 cases. And Saturday, 122. That total was 1,043 cases for the week. That is a decrease of 134 cases from last week, but it is also the second highest month that we've had. So while there is a decrease, it is still a high number. We did, the week of December 6th, have 1,033 cases, but again, 1,043 is the second highest. The ages of our cases, 0 to 10, 119, 11 to 20, 141, 21 to 30, 179, 31 to 40, 168, 41 to 50, 133, 51 to 60, 129, 61 to 70, 82, 71 to 80, 69, and 81 to 90, 19, and 91 to 100. There were 4 cases. The confirmed cases by zip code. In 01101, we saw 7 cases, 1%. In 01103, 16 cases, 1%. 01104, 165 cases, 16%. 01105, 70 cases, 7%. 07, 96 cases, 9%. 08, 207 cases, 20%. 09, 174 cases, 17%. 01118, 91 cases, 9%. 19, 89 cases, 8%. 14 cases and 28, which is 1%. 49 and 29, which is 5%. And 01151, 65, which is 6%. The 30 and under is 42% of our cases. 31 to 50, 29% of our cases. That means under the age of 50, there are 71% of our cases. Now, that number is decreasing. In October, I told you that number was 79%. So we are seeing some variances as far as the 50 and under is concerned. However, the 51 and over is 29%. That is around the highest that I've seen in that those cases. And what that means is individuals over the age of 50 are the individuals that it's more likely that they will wind up with a severe case of COVID or wind up in the hospital. So we do look at the over 50 group as one that we want to make sure we are asking to please be vigilant and make sure you are taking care of yourself and those individuals around you, your family members, and make sure that they are as well following the guidance of public health. In the race categories, there were 0 American Indian / Native Alaskan Natives. 4% of our cases were Asian, 15% Black African American, 21% Latinx, 1% Native Hawaiian, Pacific Islander, 38% white, and 21% is unknown. As the mayor said to you, we have lost in our community, in our city, 11 additional residents, and this data is up to January the 9th. And so we lost a 68-year-old Hispanic male, a 72-year-old Hispanic male, an 80-year-old Hispanic female, and a 99-year-old Hispanic male. In other categories, a 76-year-old Black male, a 77-year-old Black female, an 86-year-old Black female, 78-year-old white female, 51-year-old white male, 76-year-old white male, 73-year-old white male. It is important to acknowledge that those individuals lived in zip codes across our city. It's important to recognize the loss that families are feeling, as the mayor did, and make sure that our condolences go out to you. However, we are losing individuals in many age categories, and we believe that we can do more to prevent this virus. The vaccinations did roll out. I need to thank the staff at the Department of Health and Human Services who did an excellent job. I want to thank Springfield Public School nurses who were extremely caring, compassionate. Thank you to the Parks Department for sending us staff as well. And this could not have gone as smoothly as it did without AMR. Their vaccinators did an excellent job. There were 6 of them there for most of the day, and were very kind, compassionate, and moved individuals through the process. So thank you. To date, AMR has tested 118,978 individuals. Positives are 10,763 from that total, and 50,000 of the individuals that were tested were Springfield residents. It is important, again, I've gotten many calls, and I appreciate the individuals who have called me about how to wear your mask. Masks should be 2 or more layers and should completely cover your nose, mouth, and chin. We have seen many individuals using them below their nose, below their chin. They are really important that you cover those areas, because that's how the virus is spread, through droplets from your mouth, your nose, and because droplets fall, if you cover your chin, then we make sure that it is contained in the mask. So please, wear your mask correctly. It is not good to have a mask on and it's not doing what a mask should do. We do have, for vaccines, what is called a waiting list, but is not a waiting list of individuals. It is a list of those agencies and organizations that are in phase 1 that we can move to. And so we will do that, because it's important to get the vaccine in as many arms as we can. So there is no individual waiting list. Let me be clear about that. The mass vaccination clinics will be set up by the State Department of Public Health. The governor, lieutenant governor, and Secretary Sutters will announce those vaccination sites very shortly, because they are hoping to begin next week. So please be patient. Know that everyone wants to get the vaccine in arms, and we are all working to do that. The Vax Force will meet again. We have committees or areas that the individuals on the committee have signed up for, and we look forward to presenting to the public the white paper or the outcome of the work that committee is doing. I am extremely grateful to that committee for making sure that they volunteered and have kept up with the latest science in order to communicate it to our residents. We are still doing contact tracing. As you know, there are still positives. And so my staff and the Contact Tracing Collaborative at the State Department of Public Health continues to make sure that we are reaching out. Please answer our calls and know that even when you get the vaccine, it's going to still be important that you wear your mask, that you practice social distancing, and that you are constantly washing your hands and staying home if you are sick. The goal of vaccinating individuals is to make sure we are getting our entire population to some point of herd immunity. Herd immunity is when there is enough individuals vaccinated so we can see that the viral load is negative, going down, and the spread is something that is being contained. Right now, there is a lot of community spread, so even if you do get vaccinated, the recommendation is that you continue to use precautions until we get to the point of herd immunity. That's going to take a lot of vaccine. We are standing up, or the state is standing up, and certainly the Board of Health from the city of Springfield and across the Commonwealth will work with them. But it is going to take a massive effort to get vaccine into the number of arms that we need to do in every category. We understand that people are anxious. I've talked to many individuals who have called me who are anxious to get their vaccine, and we certainly understand that, and we want to do everything we can to make sure that that is happening for individuals and their families. However, there are the phases. We are following the phases and making sure, particularly those services that are COVID-facing, that are in the community, who work every day with populations and keep our city safe and keep our services moving forward. So we are making sure that we are following the guidance, but we are also making sure that we are not throwing vaccine away. It's important to know that once we puncture that vial, we have to use all 10 of the doses that are in that vial. If we do not use all 10, then we have to throw it away, because the vaccine, once it's punctured, is only good for 6 hours. I tell you that because if we have a vaccine left in the vial, we will make sure we are vaccinating someone who is in that environment. It is not a waiting list. It just happens that when we get to a point, if there's 1 or 2 injections left, we will figure out how to make sure we're using them. You know, across the country, you have heard stories of vaccines being discarded because it wasn't the priority population, or they didn't fit neatly into the phase. We will not do that. If we have additional vaccine, we are going to make sure that we use the vaccine for individuals who are COVID-facing staff in the city of Springfield, or certainly who might be in the area working with us to do the injections. So again, be patient. We will make sure we're again working with the State Department of Public Health. Everyone wants vaccines and arms, and the mayor has given us guidance and resources. We will continue to move forward as a municipality to make sure we are getting equitable vaccines for the Western region and giving you the information that you need to be able to get vaccinated when your time comes. Thank you.
Thank you very much, Helen, for your efforts and your yeoman work with your staff. We will now go into the public safety component of this COVID-19 city hospital update, and I will bring up the fire commissioner of the city of Springfield, Bernard B.J. Calvi.
Good morning, everybody. Thank you, Mayor. At the Springfield Fire Department this week, we have 11 firefighters out with COVID. We have another 25 that are awaiting testing who have had a exposure or possible exposure to someone with COVID. We're still in good shape. We're able to answer all our calls. All our positions are staffed. So the public is in no danger from this. We are still out there every day doing our jobs. We had a couple fires over the weekend. No one was injured, or no firefighters were injured at either fire. A couple residents were transported with non-life-threatening injuries, so we're in good shape on that front. Other than that, I know Director Sullivan is going to speak about ice safety and staying off the ice. As an extra reminder to follow up on what he's going to say, if the ice forms in the next couple days with the turn in temperatures, it will be unsafe to be out on. Do not be out there ice skating or trying to walk on the ice. That will create problems for everybody. That's all I've got for this week. Thank you.
Thank you, Commissioner. Thank you, Commissioner Calvi. And now from the police update, the police commissioner of the city of Springfield, Cheryl Clapper.
Thank you, Mayor. Good morning. On the police front, we're 25 positives and 3 are awaiting test results, so I'm down 28 officers. And as the mayor mentioned, of concern is 8 recruits in the police academy. So we have gone to a Zoom, and we're trying to do as much remotely as we can. Hopefully we get a handle on this, because there's only so much we can do remotely, and then qualifications need to be met, and a lot of those are hands-on. So we're hoping that there's not a delay in this class. I also have 3 who are called up in the National Guard who have responded to Washington, D.C. to help. I have a few others who have been called up for the month of January, and some long-term out illnesses and long-term injuries. So as of right now, it's manageable, and we keep a full complement of officers out on the street for each shift. We watch it carefully, and as the mayor has mentioned before, we are in contact with state police should we need some additional resources. Right now, we are good. I will also add to the ice safety, because unfortunately, it seems every year, as soon as ponds or waterways start to freeze over, we get at least one call for somebody that needs assistance and has gone in. So if you live by a lake or a waterway and you notice somebody out on the ice, especially as early as later this week when it's just starting to freeze over, please call us and let us know, and we'll help advise with PA systems or whatever we have to keep people off the ice until the ice is safe, which won't be for a while yet. Thank you. Thank you, Mayor.
Thank you, Commissioner Clapper. We'll now get the update of our Springfield Public Schools, and that will be put forth by Superintendent of Springfield Public Schools, Daniel Warwick.
Thank you, Mayor. Morning, everyone. So with our meals program as an update, year-to-date, we're at 5,565,314 meals. Again, we've changed one site, the Bolin site, because we're using it for vaccinations. We've moved over to Zanetti School, which is virtually next door, and that's really going well. We provided 102,640 for this weekend alone. With school reopening, we had a very good school committee meeting Thursday night, talked about school reopening dates and put forth a plan. School committee looked at that plan. The suggested opening date for our large groups of students would be beginning of the fourth quarter, but we would move it to Monday, April 12th. Now, the school committee did give us approval to explore bringing some specialized groups in sooner, as soon as mid-March, and those groups would be the high needs special ed group, the SLIFE kids, our ELL kids who have gaps in learning, and our vocational classes at Putnam for grades 10 to 12. So we'll be formulating a plan to explore that. And again, those openings will be subject to working with our health commissioner to make sure the COVID rates would make it safe to reopen at that juncture. You know, as we've been working, we're making tremendous progress working with Pat Sullivan and with the support of our mayor, making sure we're making all the ventilation upgrades in all of our buildings, which really will stand well for the future as we face future flu seasons and so on. But those are going very well. We anticipate them being finished in March, and it's very exciting to see those kind of upgrades going in. Flu shots, there's a change they're not going to mandate that requirement for families to provide the kids with flu shots before they return to school. DPH has changed that with all the vaccines regarding COVID. They thought it was a smart move to back off that as a mandate. However, working with our health commissioner, we're strongly encouraging families to go get those flu shots because it's still the best possible thing people could do. Winter sports, with the support of our health commissioner, we've had a start, very successful. We tested all of the kids and coaches. We had almost no one positive, so we've been able to move forward with winter sports. And during the year, we're going to do 2 more tests to ensure that our kids are safe participating, so that we're going to have basketball and swimming going on. You know, our focus as a team has been providing a high-quality remote program, and we've done that. We've been recognized at that across the state, and we exceed the student learning time requirements, which is very, very important that kids are getting direct instruction. And our attendance, our last attendance report was very powerful for our students. Since the beginning of the school year, our remote attendance has been 92.2%, only 1.4% off our normal attendance. So the staff has just done an absolutely fabulous job of reaching out to families and keeping our kids engaged. And again, that was due to the great support of the mayor with all of the technology upgrades we've made to provide our families with the technology, including the internet. So very grateful to the mayor and his team for all the support with that. Thank you.
Thank you, Superintendent Warwick. Core services continue, and at the heart of that is the Department of Public Works, and I want to thank Director Chris Signoli and his men and women at DPW who continue to provide those upfront core services. So without further ado, for DPW update, the Director of the Department of Public Works, Chris Signoli.
Mayor, thank you very much. The DPW currently has 5 employees out with COVID. We are continuing picking up Christmas trees. This is the final 2 weeks, so starting today, if today is your recycle day, it will be your last chance, and moving forward over the next 2 weeks will be your last chance. Last week, the state approved the transportation bond bill. There are a number of projects that are in there that affect the city of Springfield. So over the next few weeks, we'll be working with Mass DOT on how that funding and how those projects can be moving forward. Some of them are duplicates of projects that already have funding through the state, so we'll have to work with that. With that, right now, weather seems to be fine. We are looking at a possible storm next week. However, right now, everything seems good for the remainder of this week. Thank you very much, Mayor.
Thank you, Director Signoli. When we get snow, I call him the snow miser at that point in time. Now the Director of Facilities and Park Management, Pat Sullivan and his team have done yeoman work, really working very closely with any and all departments here in the city of Springfield. The Director of Facilities and Parks Management, Patrick Sullivan.
Thank you, Mayor. We have 5 out with COVID. We continue with the school municipal install of the I-Waves in the carrier unit. I'll just point out the carrier unit is operational in this room. I want to thank Eversource, and our talented trade staff working with John Kerrigan to get this work done across the city. I want to remind residents you need to schedule an appointment if you want to do any business in City Hall. We had a lot of people coming up to the door. I think they're seeing the news, a vaccine is being distributed. We are still following all the COVID regulations, and we will be doing this for the next few months, if not even longer. So please schedule that appointment. It will make our front door or back door operations working a little bit more smoothly if you cooperate. And then last, it's going to be a very cold week this week, so we got concerned about ice safety. So we are asking parents and guardians, please talk to your children about the importance of staying off the ice. It's sometimes very tempting. And to the adults that continue to go on Lake Massasoit, please stay off this area. There's a lot of underground springs. They are like quicksand, and just because it's cold, you're going to think they're going to freeze. This is water that's always running. It will not freeze, and you will sink fast. And we've had to waste our resources of police and fire to save some people. Happy to do it, but we would rather keep all of our public safety officials safe as well. So please adhere, stay off these bodies of water.
Thank you, Director Sullivan. As I always say, City of Springfield's in the business of doing business, and Chief Development Officer Tim Sheen and his team have done a great job in stabilization and trying to help businesses hang in there so we can have them rebound quickly once we defeat this COVID-19. The Chief Development Officer for the City of Springfield, Tim Sheen.
Thank you, Mayor. Knowing the level of need in the small business community, we're very happy to note that general applications are being accepted by the SBA beginning today for PPP assistance. Some smaller scale community-based lenders were able to start the process earlier. There's been a few changes to the program. The intent is to better target those businesses hardest hit by the pandemic. To date, the program has distributed over $523 billion to 5.2 million businesses. In the new round, there's $284 billion available. Eligible businesses are defined as the following: any business concern, nonprofit organization, housing cooperative, veterans organization, tribal business concern, eligible self-employed individual, sole proprietor, independent contractor, or small agricultural cooperative. There's additional requirements for new applicants that haven't already participated in the PPP program. You have to have 500 or less employees. If you're coming in for a second round of assistance, you have to have less than 300 employees. There's a $10 million cap for first-time borrowers. That cap is reduced to $2 million for second draw borrowers. And the formula is based on a 2.5 times formula associated with your monthly payroll. Food service businesses, which, as we've discussed week after week from this podium, who have been so impacted by the pandemic, their formula is 3.5%. The 2 million cap remains, though. If the loan is to be forgiven, 60% of the loan must be paid for workers. Loans not forgiven will have a 1% interest rate. Forgiven loans, this is important to note for folks, those are tax deductible, as are all of the expenses associated with the loan in terms of what you've used the loan for. The time frame to expend the loan is between 8 and 24 weeks. Just to update as to where we are with the mortgage, rent, and utility assistance. With rent and utility program, we have dispersed $1.2 million. We've assisted 405 households. Mortgage assistance, we've provided $223,000 and have assisted 79 homes. As the mayor indicated, we haven't taken our eye off of the long-term planning objectives for the city. OPED is advancing a major master planning document to the council for its approval on February 8th. The plan focuses on the geography surrounding the Mass Mutual Center and the casino. It addresses the redevelopment of essential properties in that area, which will be repurposed to elevate the convention, meeting, and entertainment environment surrounding the two anchors on Main Street. It addresses infrastructure improvements, zoning, public financing incentives, et cetera, to encourage the intended development. Thank you.
Thank you, Director Sheehan. You heard the financial update I gave earlier from TJ Plan and Solicitor Pakula on law and HR labor with Attorney Bill Mahoney. So at this point in time, we'll take any questions or comments you might have of my cabinet heads or myself. Sure, Eric. Mr. Clapper?
We are, and I won't really disclose how, but I will tell you there are plans in place for everything from a small protest to a large event. I do have some partners in this if it gets larger. And as the protest you saw over the summer, the mayor and I are on the same page of being overly prepared rather than underprepared. So I checked with the Fusion Center and my Crime Analysis Center before this meeting, and there's absolutely nothing indicated for Springfield or Worcester. Boston has a few events that they are preparing for, but we are prepared for whatever if something should occur here. As of now, nothing that we can tell is scheduled for Springfield.
I have one more question, maybe Carl, you could get in on this.
Mr. Calvin?
Police department and fire department, do you guys have any of your employees deployed to the National Guard to our nation's capital?
Yes. I have 3 that were called up recently and on their way. I have had about 3 or 4 that were previously called up. I don't know their assignments, if they're there or if they're in Boston.
We have a couple people deployed, but I'm not sure where they're deployed to.
Thank you, Commissioner Crowley. Commissioner Clapper? Any other questions or comments? Paul? Sure. Superintendent Warwick? Dan? Notre Dame is calling. You like that, Helen, huh? I knew that would get your attention. Paul Tuthill has a question for you.
Hi, Paul, sorry. Didn't hear. Yep. It would be done in a hybrid model. Yeah, because we're going to follow all the CDC guidelines. There's no way we could bring everybody in and keep folks 6 feet apart. So it would be a hybrid, so it would be kind of the 50-50 piece we were talking. So it would be Group A would be Monday, Tuesday, and every other Wednesday. Group B would be Thursday, Friday. Now, our high-need SPED kids, our SLIFE kids, and our ELL 1 kids, we would try to bring in 5 days a week if possible, even if the others weren't hybrid, because they would need that. But for all the other kids, it would be a hybrid, and it would an A-B schedule.
And are you, in the event of this party, are you planning to have another virtual town hall that goes all the plans in advance?
I would think that before we make any decisions, there probably would be another virtual town hall that the school committee would want to schedule and get more feedback. And again, it would be subject to working with our health commissioner based on the COVID rates at the time. And the one thing to remember too, that for parents, if they want their child to stay remote, we're going to contact all the families. So any parent who wants their child to stay remote for the rest of the year, we're going to honor that request also. Sorry, Mary, didn't hear.
That's okay, Dan. I was able to work in a good line there.
Excellent.
Okay. Thanks. Any other questions or comments? I have to say, what's really reassuring school committee members, administration, is many times, if not all the time, Commissioner Helen Calton Harris and Director Pat Sullivan are on those meetings, and that's really reassuring for school committee members on these difficult decisions that have to be made. Man, I'm sorry, go ahead.
Question for Commissioner Harris.
Sure, Commissioner Calton Harris?
In terms of the vaccination program, was the city responsible for the vaccination for first responders when you were running that?
That's correct.
And how many of the city first responders were able to do last week?
We did 920 vaccinations. I think I would leave it to both commissioners. I cannot tell you based on the sign-in how many were firefighters, how many were police officers. We then moved to home-based healthcare. We moved to homeless shelters. So we stayed within the list of phase 1 vaccination, but I cannot specifically tell you how many first responders took advantage of the opportunity.
Was it intentionally specifically targeted at Springfield, or was it any first responders in the area?
The vaccination clinic was for the city of Springfield. However, we did do some first responders from the city of Holyoke and some court officers from the city of Springfield.
And was there, I've heard some reports that some people that were not specifically first responders showed up at this clinic. Have you seen anything about that showed that they're not, who may have been city employees or may have been, in that rough area were not actually eligible, showing up at Poland, and I don't know whether they were vaccinated or not, but there was some reports of that happening.
Absolutely. We did have individuals who showed up who were not in that priority group. If there was vaccine that needed to be utilized, then we did that. And so again, our goal to use vaccine that's on site. We also needed to have list of individuals that we could call up, and that might include individuals who work in the city. And so we could call and say, can you come? Because we have a vial and we have 8 doses left in that vial, and that happened as well.
Thanks. Any other questions or comments? Okay, hearing none, again, I want to thank very, very much the media partners that are here steadfastly, the TV and radio and print media, for getting out this important information weekly, if not daily. We appreciate that. I want to thank my cabinet heads and to rank and file who have been tested and true, as I say many times, through a number of natural and man-made disasters, as we continue to protect and preserve our workforce and provide continued core services moving forward. I want to thank you, the public, for your patience, your collaboration, and your cooperation. I know it's been a bit, more than a bit difficult. It's been very aggravating, but we have to stay vigilant and keep doing what we're doing, and we will defeat this COVID-19. I want to thank the partnership with our medical institutions, Bay State and Mercy, Dr. Kerouac and Dr. Roos. We coordinate very closely. If, God forbid, a family member, a friend has to be hospitalized. And my whole team, from cabinet heads, and Commissioner Helen Calton Harris, and I, to my internal staff, I want to thank my internal staff. They've been with me 24/7 at times, my Chief of Staff, Tom Ash, on down. We will continue to advocate in a diplomatically but aggressive way for continued expansion of testing and getting as much vaccine as we can into arms as possible, in working with our medical providers, AMR, Patrick Leonardo, as quick as possible. So With that, I wish each and every one of you a good day and good health and a successful start to the new president, Joe Biden, and new vice president, Kamala Harris, as they put forth a plan to move our nation forward, especially, and I think Helen and I, and many of us have said, there never seemed to be a coordinated, specific, succinct plan from the federal level. I think we're going to finally see that. And you're always going to have kinks here and there, but a full commitment within the first 10 days of this administration to move this vaccine, supplies, PPEs, use that Defense Act. That can only spell good for the city of Springfield. Thank you all. Good health and God bless. Thank you.